Pre-surgery taping for cleft lip. If your baby is born with a cleft lip, this means that there are 1 or 2 gaps in the lip. This is one of the commonest and most correctable birth defects. A unilateral cleft lip is where there is 1 gap in the lip. A bilateral cleft lip is where there are 2 gaps in the lip. Pre-surgical lip taping is done to help the surgeon in reconstructing the wide gap in the lip. It is simply a skin tape applied across the gap with some tension to slowly pull the lip and nose together over a few weeks. This causes the cleft to become narrower and the lip and nose to be in a better position by the time your baby goes for surgery. After milk feeds and before applying new lip tape, you should clean the baby's mouth, nose, and tongue. First, wash and dry your hands. Moisten a gauze or clean baby cloth with cool boiled water and wrap it around your little finger. This acts as a mop to remove milk curds from the mouth. Gently use this little finger to mop the upper and lower gums. Change a gauze or use a new side of the gauze to wipe the inside of the cheeks. Do the same and wipe the hard palate and the tongue. To clean the nostrils, wet a cotton bud and wipe around the rim of the nostril, paying attention to the gap in the nostril floor. Check all the hidden corners for milk curds with a torchlight. Lastly, wipe the skin around the mouth. What you will need: a barrier sticker. This protects your baby's cheeks from getting rashes from the adhesive on the skin tape. Frequent removal of the steri strips from the cheeks can also irritate the baby's skin and cause skin tears. We use a thin piece of hydrocolloid dressing, such as duodenum thin or Comfeel thin. These can be changed every 2 days. Steri strips. These are non-stretchable tapes that are very sticky. They come in various widths. You can choose a suitable width for your child's lip or cut them down to desired width. Scissors for cutting the stickers and tape. A swaddle may be useful to stabilize your baby's arms while you apply the lip tapes. Cut the barrier sticker base to the desired size you need. This should be a little larger than the width of the steri strips. Apply them on both dry cheeks, roughly at the level of the premaxilla, which is the central piece of lip. Choose a suitable width of steri strip, such that the nostrils and the red lip will not be covered by the strip. Estimate the length of the steri strip you need to span the 2 cheeks, with a little excess to fold in on one end. This ensures easy removal. Apply the center of the strip to the premaxilla first, and then push one cheek toward the midline, and when you are happy with the tension, tape down to the duodenum base. Repeat on the other side. You should observe the gap narrowing if done correctly. Sometimes the lip segments may even meet. In the unilateral cleft lip, taping is similar to that of the bilateral cleft lip. In the unilateral cleft lip, the duodenum base is placed at the level of the lip gap. Steri strips are also measured to desired length, cut and folded in on one side. Secure one side of the tape to one cheek first, pull the tape across the gap with the aim of narrowing the gap as much as you can, and then anchor the tape to the other cheek. Done!